Hello, welcome back. So in this video, we are going to talk about actually how to track your cycle. So we started off learning about why it's important. Then we talked about your cycle, what's happening when, so you have a good background and understanding of what's going on behind the scenes. And now we're going to actually talk about how you're going to track your cycle to figure out exactly when you're ovulating. So today I'm going to teach you 4 ways to track your cycle. There is a 5th way, but it's not very popular amongst my patients when I try and teach it to them. So I'm going to touch on it later, but it's not what we're going to focus on. So we're going to focus on 4 main ways. The main ways are using a calendar. The next way is using your cervical mucus, also known as cervical discharge. We are going to learn about our basal body temperature and also using that LH spike, also known as like your ovulation hormone, to see when you're ovulating. So let's jump into the first method. So that is the calendar method. This is the most simplest method to figure out when you are ovulating. So what it does is it'll tell you the day you ovulated in the previous month, and you can use that to kind of estimate when you're going to ovulate in the following month. So all it is take day 1 of your period minus 14 days, and that is the day you ovulated last month. So whatever cycle day that is, just say it's cycle day 14, most likely the following month you'll ovulate around that cycle day. So it's a good way to estimate when you're going to ovulate the following month. I wouldn't use this method alone because it's not always perfectly accurate because there's a lot of other things going on in our body, but it's a good estimate. The next way to track your cycle is using cervical mucus. Some of you call this some of you call this discharge. So how this works, at the beginning of your cycle, so day 1 is when you're going to have your period. So during the beginning of your cycle, you're not going to notice that you have cervical mucus because the period blood is covering it. Once you finish your period, you might be someone who has dry days, so that's perfectly normal, but you also could be someone who has cervical mucus. So at that point, it's going to be more creamy because you're not ovulating yet. So it's either going to be dry or sticky or creamy. As estrogen goes up, like we talked about in the in the last video, that is going to make your cervical mucus more watery. It's going to get more watery as you approach ovulation. So in your underwear, you actually might see like a wet spot, like a nice round wet spot, and that means ovulation is coming. Once you are ovulating or extremely close to ovulation, your discharge is going to get very wet and stretchy, and it's going to start to resemble egg whites. And if you look in the picture, like you'll actually be able to stretch it between your fingers. When you see that discharge, you are ovulating any moment. So it's a good time to start trying. So it's a good idea to start tracking your cervical mucus and writing it down. So I have a paper chart for you in the handouts that we'll talk about after, but it's a good idea to really start noticing your cervical mucus, really start getting to know what it looks like. And sometimes you are someone who doesn't have copious amounts of cervical mucus, so you might have to stick one finger in the vagina to monitor it, or when you wipe, just look at that Kleenex. Yeah. So then the next way to track your cycle is going to be with basal body temperature. So in order to do this, you need to use a basal body thermometer. So what's the difference between a basal body thermometer and a regular thermometer? Well, this thermometer is going to measure to 2 decimal places. That's really, really important because we're not looking for a fever here. We're looking for a change in your core body temperature. So basal body temperature is your lowest core body temperature. So what this does is we can use your core body temperature to confirm that you ovulated. So we can't use it to say, okay, you're ovulating the next day. We're going to use it to confirm ovulation to make sure you did ovulate and use that to estimate the date for the following cycle. So what's going to happen with basal body temperature? If you look at the graph, it's the orange line. So at the start of your cycle until ovulation, you're going to hover around certain numbers. Yes, it's going to go up and down a little bit, but it's going to hover around certain numbers. The day before you ovulate, you're going to have a drop in that temperature. Then you're going to ovulate. And then after you ovulate, in the following day or 2, your basal body temperature is going to spike up. It's going to go up 0.3 to 1 degree Fahrenheit, and it's going to stay elevated. And remember, under the presence of progesterone, your basal body temperature stays elevated. It elevates that temperature. If you become pregnant, it will stay elevated. If you don't, and you're going to get your period, it's going to come back down to those pre-ovulatory temperatures. So how do we take our basal body temperature? So it's really important, if you can, to take it before getting up from bed and to take it around the same time every day. If there's any movement, or you take it at different times, it's really going to change the number and you're not going to have the same base number. So if there's a day where you know it's at a really different time, I would suggest not taking it that day, just skipping that day. So basically any changes in like medication, in your room temperature, in movement, or if you travel, it's all going to affect the results. So that's why it's really important for basal body temperature to try and keep things the most stable as possible. And it's good to do this for a few months, because there's so many reasons why the temperature could be different that the longer you do it for, the more accurate it will become. But for some people, they really have a huge change in temperature when they ovulate, so it'll be very noticeable. But for others, it'll be a very tiny, tiny change. So that's why doing it for a couple of months, like I'd say at least 3 months, you'll really get to know your cycle and your body temperature changes. The next thing we're going to talk about is ovulation strips. So ovulation strips measure LH. So as we learned about earlier, LH is luteinizing hormone. That's your ovulation hormone, and that makes your egg drop. Ovulation hormone, or luteinizing hormone, is going to peak 24 to 36 hours before you ovulate. So these strips, you can use these to say like, okay, I'm going to be ovulating in the next 24 to 36 hours. It's time to try. So that's also why these are really popular, because it tells you exactly when you should start trying. So if we look at this graph, ovulation is going to be we're looking at that purple, the purple line. So basically, at the beginning of your cycle, you are going to have not much ovulation hormone present. It's not enough to make the test positive. As you approach ovulation, luteinizing hormone is going to start it's going to start increasing. It's going to get higher and higher until it peaks. When it peaks, that means you're ovulating in 24 to 36 hours. It's time to start trying. And then luteinizing hormone is going to take a few days. It can take several days for it to come down. So that's why the timing of this test is critical. Because the hormone goes up and then slowly goes down, we want to make sure that we're testing at the right time, because it's possible that you test, but you're actually and it shows that it's peak or that it's high, but you're catching it on the way down. So that means you will have already missed ovulation. So sometimes people are testing on random days to see if they're ovulating. They're getting a positive, they're trying, and they're not getting pregnant. But that's because you're catching it on the way down and you've already missed ovulation. So what you need to do in order to avoid this is you need to start testing well before ovulation. And how you know when to start testing is, if you open up our ovulation tests, there's going to be an instruction manual. In there, there's a chart. This chart is going to say the length of your cycle. So if you have a 28-day cycle, you're going to start testing on day 11. This way, we're going to be able to see things just like this graph. You're going to see when it's lower, and you're going to see when it starts to come up. And that's what we want to do. We want to be able to see it come up. And then when it's at its peak, that's when you know, okay, in the next 24 to 36 hours, I'm ovulating. So this here is actually a screenshot from an app that we are releasing soon. And this is the ovulation strips here is a really good example to show you what you're going to expect. So if you look at the first strip, this is when you start testing. If you start testing like well before day 11, just say, you're not going to set off the bottom line. So the bottom line is the test line. The top line is the control line. Test is like how it's measuring the LH, so the ovulation hormone, and the control line is what you're comparing that to. So at the beginning, when there's no LH present or there's very little, like not enough to set off the test, there's going to be nothing. And as you approach ovulation, it's slowly going to get darker and darker and darker. And so a positive test is considered when you're as dark as the control line or darker. That's when you're at peak. If it's just a light line, so like in the second, third, and fourth, that means LH is high, but it's not peak. So you're not ovulating the next day. You really need it to be as dark or darker than the control line. So let me show you how to use an ovulation strip. So you are going to open up the package like this. So away. You are going to take the strip out. So the strip is going to look something like this. And then you are going to take your little cup. Here's your cup. Your cup. You're going to pee in the cup. And then you're going to dip the ovulation strip up to the max line. Then you're going to let the dye rise. So the dye is going to rise. And once it's risen, you are going to set it aside for 10 minutes. So you're going to read it after 10 minutes. And it's really important to wait those 10 minutes just to make sure. Okay. Then you are going to compare it to these lines right here. So you're going to see where it sits. If it sits in 2, 3, and 4, that means LH is high. If it sits at the last two, that means it's peak. And there's also a nice little reminder on the back of the ovulation strip. So that's how you use ovulation strips. So now I'm going to go into the next part of ovulation. So there's other symptoms that can tell you that ovulation is approaching. And these can be really, really helpful, and they can also really help you get to know your body. So here are some other symptoms. So the first one is the one I told you about before. So some people use this to track ovulation, but from my experience, it's not very popular in the people that I've explained it to. So what's going to happen when you're about to ovulate? Your cervix is going to become soft. So if you start feeling your cervix throughout your cycle, you're going to notice the texture change. So before ovulation, or when you're ovulating, it's going to become soft. It's going to move higher up, and the reason for that is it's preparing your body for sex. So it's moving up so that you can have sex. It's going to become the opening in the cervix is going to open to allow sperm to enter, and it's also going to become wet. So that's with the cervical mucus. Also, due to changing estrogen levels, you can have mid-cycle spotting. So you might notice some spotting when you ovulate. Something else you can notice is pain or achiness near the ovaries. This is also called, I can never pronounce it, Myrtle Schmerz. And that's when you have like those cramps you sometimes feel on one side during ovulation. And what they think is responsible for that is when the egg drops, there's a little bit of like fluid and blood that leaks out, and sometimes that can irritate your uterine lining. You're also going to have an increased libido around ovulation, self-explanatory. You are going to have an increased libido because you need to have sex in order to reproduce. Your vulva is going to be swollen, and that's because there's going to be increased blood flow to the area. You can get water retention from those changing hormone levels. You're going to have improved energy because you need energy to have sex. You are going to have heightened vision, smell, and taste, and that's because you need to find a mate. And then increased sensitivity of the breasts as well due to hormonal changes. So you can look out for any of these symptoms as well. So using these symptoms, ovulation strips, your basal body temperature, your cervical mucus, and the calendar method, you are going to have lots and lots of information about yourself in order to track your cycle and see when you're ovulating. So it's about putting all of these symptoms together. So what I recommend to do is to track your cycle using the paper chart or an app, it's up to you, and recording all of this information. Because the more information you have, the more you're going to know exactly when you're ovulating. So you're going to record your basal body temperature every day. Your LH strips, you're only going to start recording with the day that I told you about in that chart. Remember this chart? You don't need to test every day. Only start on the day that you're supposed to. Keep going till you get that peak, and after that peak, you can continue if you want just to follow it downwards, or you can just stop, just so you're not wasting so many strips. And then obviously record when you have sex. And then cervical mucus is very important. And then symptoms. So